If you have just accepted an offer for the internal medicine training in the UK and you want to know more about its structure, how to get the assessments done, how to make the best out of the training, and you want to know more about different terms that are usually used on the e-portfolio for the IMT, that's the place for you. I'm Azzeddin Barakat. I'm one of the internal medicine trainees in the UK. Currently, I'm doing the second year. I'm about to finish it. It's my last rotation. And I'm very excited to do this playlist to discuss all what you need to know about the IMT. In today's video, it will be an overall look about the training and what you need to know at this level and what you need to do before starting the training. And in the subsequent videos, we will talk into more detail about very specific things. We will go through each section of the portfolio and we will demystify different terms like the ACATs, the OPCATs, the SLEs, the TPDs. Everything that you need to know about the IMT, you will find it here. And I strongly recommend you subscribe to my channel so that you don't miss any video. And without further ado, let's get started. What's IMT? IMT is the core level training in internal medicine. It was previously called the CMT, Core Medical Training, and it was only 2 years. Now, since 2019, it has been changed to the internal medicine training. It has been extended to be 3 years. In the first 2 years of the training, you will work as an SHO, a senior house officer, which is technically a junior doctor. And in the third year, in IMT3, you will work as a supervised registrar, medical registrar. And that's one of the big changes compared to the CMT, because this offers you a smooth transition between being an SHO and being a registrar. In each year, and according to the program and the deanery, you will do 2 or 3 rotations because the length of the rotation varies. You will have to do 2 mandatory rotations. Geriatric rotation will be usually in the first year of the training, and ICU rotation usually happens in the second year of the training. And in the third year of being an IMT, the case in my deanery is that you do 6 months of being a medical registrar in acute medicine and another 6 months in one of the specialties according to the preferences. Things vary slightly from a deanery to the other, but that's the outline. Wherever you will have the training, you will do at least 2 mandatory rotations, and you will get good exposure to the core medical specialties as cardiology, gastroenterology, diabetes and endocrine, stroke, according to what you will choose. Each training year starts in August, and 10 months later, in June of each year, there is something called MRCP, which is the annual review of competency progression. What this basically means is that the training directors meet together to see what you have done in your portfolio for this year and make sure that you are up to date and on track in relation to what you need to achieve by that time of the training. And this brings us to talk about what you need to achieve or what you need to finish in the internal medicine training. First thing is the MRCP. First 2 parts are written exams, and the third exam is similar to the OSCE style but includes communication stations and long history and examination stations. But you need to finish the whole membership exams in the first 2 years. Sometimes, for various reasons that might happen, you might find yourself going into the third year without finishing the membership exams. This doesn't stop you from progressing into the third year. However, you will not have a typical outcome or a favorable outcome in the ARCP. In 3 years of training, you need to at least see 500 patients of unselected acute medical take. In 3 years of the training, you need to attend at least 80 clinics. In each year of the training, you need to complete some work-based assessments. You need to get some reports from the consultants and the supervisors that you worked with to ensure that they have a positive feedback about you. In each year, you need to get what's called MSF, multi-source feedback from your colleagues that you have worked with. You need to attend minimum number of teaching hours each year. You need to attend few simulation courses, and you need to complete one quality improvement project during the full length of the training. One last thing, you need to have a valid ALS throughout the length of the training, but I don't think that's specific to the IMT. In any training, you will need to have a valid ALS. There are also some hand skills that you need to be signed off to perform unsupervised by the end of your training. Lumbar punctures, nasogastric tube insertion, ascitic taps, pleural taps, DC cardioversion, and leading a team during CPR. There are a few other skills that you will have chance to do in the skill lab and can get signed off, but they are not mandatory, like the pleural drain, the ascitic drain, and central lines. And as I said, they are not mandatory, but I would strongly recommend that you get signed off for these skills, because especially the central line, this will be an essential skill that you might need to perform in your work as a medical registrar. While all of this might seem a little overwhelming, let me reassure you that usually you have good support to do what you need to do. For example, in each rotation you have protected clinic time to enable you to attend the required number of clinics. You have protected teaching time during each week. You will have a study budget, and this differs according to the deanery, but the standard is that you get £1,000 each year that you can request to pay for courses, books, attending conferences that will help you achieve the curriculum requirements. You will be assigned supervisors. So in each year you will have an educational supervisor, and that will be a supervisor for the whole year, and a clinical supervisor in each rotation, and usually it's from the same specialty of the rotation. You will meet with each one of them usually at the start of the rotation and at the end of the rotation. They will help you achieve what you need to do in each rotation and discuss with you the best way to achieve each one of them. And to help you document your achievements, reflect on your practice, and plan what you need to achieve in every rotation, you will get access to the portfolio of the Joint Royal College of Physicians Training Board. You will have to pay for it, unfortunately, and cannot claim that from your study budget. However, you can claim tax relief later on, and it costs around £600. So this was a short overview of internal medicine training structure, what you need to achieve, and what opportunities you have to help you achieve those things. What you need to do now before starting the training is get the sponsorship if you need to apply for a visa, pay for the NHSE portfolio to start having access to it, and wait for more videos in this playlist, which will include how to tackle every single point of what we discussed today, easiest way to achieve each one of them, how to plan ahead, things that basically I wished someone told me before starting my training. I hope you enjoyed my video. I would strongly advise you subscribe to my channel to see the next videos, and at the end, thank you.